Hello, welcome to this new tutorial of the head and neck examination. So in this tutorial, we're going to examine the head and neck. The second slide. So for the examination of the head, stand on this side, we're going to start by examination of the eyes. So you look at the conjunctiva, the corneal conjunctiva, and you have the bulbar conjunctiva. So this is the bulbar conjunctiva. You see how the conjunctiva are pink. You look at the sclerae. The sclerae, you see how the sclerae are anicteric. So those are the first aspects you have to know. Now on the head examination also, you have to look at the level of the nose. Normally you have to open with the nasal speculum in order to visualize the nose. You open at the level of the mouth. You use your tongue depressor. The tongue depressor, you try to visualize the uvula, you try to visualize the pharynx. For pediatric cases, you try to visualize the tonsils that are posterior. So those are the different things that you have to evaluate. The next thing that you have to evaluate is to evaluate with the otoscope, that is the ear. So the otoscope, you just put, in order to do an otoscopic examination, what you have to do is that you hold the ear, the pinna of the eye, and then you put one finger, your otoscope inside, and then you try to evaluate the tympanic membrane inside. Try to evaluate the tympanic membrane inside. You can use the different entries. So I'm going to put up the different entries. So you can use this, and then you pull the pinna of the ear, and then you try to evaluate the tympanic membrane. So that is for the ear examination. That is the internal examination of the ear. Now for the external examination of the ear, you have to observe at the level of the pinna. You have to palpate the pinna to find if there is any irritation. And then lastly, you have to press at this site. This site is called the tragus. This is the antitragus. Generally, to find if there is any abnormality in the middle ear, you have to press at the level of the anterior tragus to find if there is any pain. If there is pain at the level of the anterior tragus, it means that there is an abnormality of the middle ear, and that's where you have you necessitate now an otoscope in order to visualize. So after the head examination, the next examination I'm going to visualize is the neck examination. For the neck examination, you have to visualize at the level, you have to examine the thyroid gland. You see? To examine the thyroid gland, you have to locate yourself posteriorly to the patient, and then you have to palpate on both sides of the anterior sternocleidomastoid to palpate the level of the thyroid lobes. And then you have the isthmus of the thyroid, that is anterior. So here I'm feeling the thyroid gland, but it's not enlarged. Next thing, at the level of the neck, you have also to palpate the level of the anterior cervical lymph nodes. You palpate the posterior cervical lymph nodes. Palpate the posterior auricular lymph nodes. You palpate the occipital lymph nodes. You palpate the submandibular lymph nodes. You palpate the supraclavicular lymph nodes. So all are the lymph nodes that you're supposed to palpate at the level of the neck. Also, inspecting the neck, you should try to find if there's any abnormality of the neck and all the neck. So from here, you're finished with the head and neck.